Good morning from the capital city of Trivandrum in Kerala, where I am right now. And it's very early morning. It's about 7 o'clock in the morning. And we are having the first of our series of shoot for this INI exams. And it's become almost like routine practice for me now. Like I'm interviewing these toppers who always get rank one. And I think this is the third INI exam that we're having after the launch of the app. And I think every single time, fortunately, by the grace of God, we've been able to score rank one. And in between, we had two NEET exams also. And it brings me immense pride to actually be talking about the fact that nephrology being my science, a science that I took up as my career with a lot of passion, which I think passion is not the right word. I think it's more than that because my thing with nephrology is something I believe is like which I cannot explain. So that level, that nephrology, when I see people taking up as their career again with that much of drive, it gives me immense pleasure. And today we have another topper who is again a genuine topper. No, people are genuine toppers. Ranjan Kumar Sahoo has got an excellent academic background. Coming from interior Orissa, he is now Odisha. He is now been able to what is really make his mark at a national level. This is called making your mark at a national level. He was able to crack AIIMS and PGI back in 2019. He joined PGI, and that was, I think, single digit rank two. And now he's got rank one in INI SS Nephrology exam. So, studying MD in PGI, planning to do DM in AIIMS or PGI, depending on the setting. And that is just awesome. I mean, you just got everything on a platter. And it's MBBS from AIIMS Bhubaneswar. There's a second batch at AIIMS Bhubaneswar. So I think this interview might be of help to a lot of people in so many ways. One from for a set of students who are from not core cities like Bombay or Delhi and who really want to make it to a limelight. Second, for a set of students who are studying in medical colleges where you are in the first batch, the second batch, or the third batch, where you don't get that much help from seniors. How do they actually get into central institutes with that much consistency? And why to really think of nephrology as a career? What options does it open up? So many questions to ask this young, vibrant Ranjan Kumar Sahoo, who is very special for Marrow for one reason that he's got an association with Marrow post MBBS. He was part of the question bank team for a short time. So I think he really knows how this works. So hearty congrats, Ranjan, and welcome to the show. And a lot of thanks for taking time out in this morning when I know you are very busy with a lot of other things. And he's joining us from Madhya Pradesh at Jabalpur. So welcome, Ranjan.
Thank you, sir. Thank you very much. It feels nice to see you again after a long time, sir.
My first question is again something totally unrelated to the entrance exam. When you actually were you a person from school who wanted to do MBBS itself, or you just happened to come to MBBS?
Sir, frankly speaking, the place from where I come, you have only two careers. Like, if you want to be, either you become a doctor or an engineer. So, since my brother-in-law is a medicine specialist, seeing him, I
Okay,
got inspired to become a doctor. Okay, so that's how I
okay,
landed up in medical care.
okay. And it's generally very strange. So you studied at Bhubaneswar AIIMS, where you were just the second batch. Did you ever think like during that study period, you were thinking like, okay, I will come to the mainstream and I will come to Delhi or I come to Chandigarh, I'll come to AIIMS and PJ. Did you know that, okay, these are the big institutes in medicine. We have to actually reach there. And you made a plan accordingly and did you reach there or it just happened organically?
Uh, I will say that those credit goes to my seniors actually. The first batch, the first batch, what my senior got rank 6, and he entered AIMS Delhi. That's when our eyes and ears opened up that it
Oh,
is possible from our institute. Okay, so
okay.
we are being taught in a good way. We just need to focus and prepare. If we are preparing well, we can reach. So from there, it became a trend in our institute. If you see throughout last 5 to 6, 7 years, each exam
Yeah,
there will be at least one or two students from AIMS Bhubaneswar in top 10. That is for sure.
correct, correct.
Okay.
Yes, very true.
Currently, during my MD also PGI, it was like a mini AIMS Bhubaneswar there. Uh,
Yes,
so like we have a lot of like we do the trend is there. So then it was set by our seniors, and we keep on like everyone believes that we can enter into PGI and AIMS Delhi. So
very
because
good.
of that only
And
we were able to come here.
super. And how was the transition for you from MBBS at AIIMS Bhubaneswar to a institute like PGI where many people are finding it even difficult to survive? People are saying so many of the departments are very toxic. Will I be able to actually manage the workload? And I think your AIIMS Bhubaneswar internship wouldn't have been that very hectic or anything. So you would have had a normal course at Bhubaneswar and you are from Odisha, so that would have been okay. From there, kind of planting yourself in Chandigarh with a completely different landscape in such a hectic setup, how were you able to manage that? What were your initial apprehensions and were they true and how did you break them completely?
Yeah, see, the dream was to come to AIIMS Delhi or PGI initially. So whatever
Okay.
be the condition, okay, everything, with time we will be able to manage it. Okay.
Yeah.
If you really want to do something good or you want to, achieve something great, you have to, take care of all the smaller
Yes.
things. You can't make them their highest priority. Okay.
Correct.
So
Correct.
just I thought, okay, language I know Hindi, and like I knew that okay, fair enough, I can manage with
Yeah.
language and the food also. And
Yeah.
luckily I had really I have made a very 3 4 very good friends in the institute, to
Oh.
sail through that initial first year, the toughest period.
Yeah.
So that really, like, having good friends over there really helped me, to sail through easily during those time. And
What was
the
your work schedule like? Share with us your like many people would want to know first year at PJ how it is like. How do you get time to sleep? Do you actually get time to do something for that matter? Every day is 24 hours. What is the work schedule first year at PJ Medicine?
If I say truth, obviously it's very hectic. Okay, the
Yeah.
first year,
I know. You should tell me exactly how it is. Yeah.
exactly. If I say that we go, if we're in emergency, we'll go morning 8 o'clock and come back at night 3 and go back again next day morning 8 o'clock. It will be like for
Yeah.
continuously 15 days, 20 days.
Very
Okay.
good. Yeah.
Then if you are in ward, you will be like going in morning 8 o'clock and come back by 10, 11, and that will be the earliest.
O-
Like it's an early day
Okay.
for you. So
Yeah. Yeah.
initial year
And
will
what
be
about
tough.
round the clock duties? 24-hour duties?
That thing is there in PGI. Like we don't get like even if we get 24-hour duties, the nights will be little bit cool. Like every day you will get somehow 3 to 4 hours sleep, at least 4 to 5 hours sleep. Somehow you will manage
Okay.
in between.
Okay. That is there. It's
And
not like you will not be sleeping for 2 days continuously. That is not there.
no, 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 no. That is not
No.
there. You will be
Okay.
having like every day you'll get your 5 hours of sleep somehow. That is here.
Okay.
And the seniors, most important is we have a very good like culture there. And so seniors and all everyone is very helpful with each other. So no
Okay.
one will be bossing around with everyone needs everyone's help. So everyone is dependent on each other.
Okay.
So no one will be
Okay.
bossing around. Ki, you have to do this, you have to do this. Everyone takes care
Okay.
of everyone. And the faculties are really good. So
Okay.
yeah.
Right. So, like at the end of your first year of your MD, what was your feeling like? Did you think of any subject which you developed interest, or you were more inclined towards this critical care background? What was your impression at the end of the first year of your MD? Where did you stand?
Uh, Frankly speaking, I had the people. I feel people who know which subject they want, which subject they
Hmm.
like the most. They are God gifted. They know. Okay, they
Hmm.
have to study this subject. That's it. Nothing else. I
Okay.
have an issue with, like, whichever subject I study, I like that subject. Wherever I
Yes.
am
Yes.
posted, I like that posting.
Yeah.
So I'm like everything is good for me. Okay. So, but I was like more. I had a little fascination towards critical care,
Hmm.
towards nephro, and
Hmm.
towards rheumatology. So at last,
Okay.
like I could narrow down my ear to that I want like either nephrology or rheumatology would be the best year for me. I am like I don't want
Hmm.
the hardcore intervention. I don't want like then I thought okay
Hardcore theory. Yeah.
theory also is a thing that I thought like my friends like my seniors seeing them somehow and during my nephro posting somehow I thought like nephro is a quite balanced subject for me where I can
Yeah.
have my OPD like apply my theories. Each and every systemic disease will have some nephro complications,
Correct. Correct.
nephro component, and I do have fair amount of interventions and that upcoming transplant.
Yeah.
So like nephro will
No,
give me and
I'm asking you like just explain to us about your posting in nephrology at PJ. How many months did you have? What was the posting like?
So in first year, I had a 1 month of nephro posting where it will be like,
Oh,
just like in first year, complete
yeah,
sampling
yeah,
and getting
yeah,
reports and
yeah.
just 1 year. And in second year, I had 1 month of nephro posting where you will be the
Oh,
one under the nephro SR, like super specialty SR, and you will be taking the cases, nephro cases, and
yeah,
you'll be discussing with your SR and managing the
yeah.
cases. So that's
Okay.
where I had a 2 months exposure of nephro, and
Yeah,
throughout every most of the patients will require nephro consultation during
yeah,
in a tertiary care institute. Some
yeah.
component of nephro will be there mostly.
So, what were like your impression of the other postings? Like, so in comparison to Nephro, did you enjoy cardio, neuro, gastro, all the postings in the same way at PJ? How are the departments there?
Departments over there, I will say that gastro is bit tough because gastro is always a hardcore intervention branch.
Yeah,
You need to be
yeah, yeah,
fast, you need to act fast, otherwise you will just lose the patient
yeah,
any moment.
yeah.
So that
Correct.
was a bit tough posting for me, but rest other all of the postings we really enjoy because we in PGI the good thing is we are posted in a super specialty, but we are equally involved in managing the cases and seeing like it's our
Correct.
responsibility. So
Yes.
that way we learn directly from the super specialist, all our DMSRs, and you learn the correct
Yeah,
thing. Yeah, and you see
yeah. Correct.
all kind of things like in each subject you get to see all kind of cases. So
Yes.
that really helps you. Like if you have seen something and done something,
Yeah.
it will always be there in your mind somewhere. So that
That
really
is what
helps
I
me.
also always keep on telling in class. No, the subject is not about reading; it is about seeing, doing, seeing, doing,
Yeah.
seeing, doing. Now that is the first question I want to ask you over here. Two questions which specifically your juniors have asked me to like put across you. One question, both the questions I'll ask you here. You have to give me the answer. One question is like if you do MD in a center where we don't have PGs in doing DM, and we are actually the central responsible person. Some people wrongly take it as an advantage. Whereas in reality, having DMSR sort of helps. So your views on that. Second is major confusion which students have now because I just attended IRACON at Indore last week and we got a set of PGs who are in final year from Delhi and the same question they've been asking again and again like, sir, at this point when we are entering second year to final year, that transition phase, we all are now in love with medicine. We've just loved our medicine. First year was very tough. Second year we started to like the subject. We don't feel like leaving the subject and going to another science completely and going to a science wherein we will be losing touch with medicine. So we really don't want that at the back of our mind. But a complete societal pressure is to take up a subject and become a specialist, and people are fighting you, telling that if you don't become a specialist, then you will not have a career tomorrow. So we are completely caught up, sir. We want your view on that. So my view I'll share. So these two questions, I want your answers or your views.
Okay, so the first I'll answer the second question.
Yeah,
The second
yeah,
that is more important, I feel. Okay,
yeah,
what I felt is just after completing my MD, what I could decide my career is nephro, like based on certain criteria, and yeah, I could decide it
yeah,
finally to be nephro in my after like during my final exam only. That's it. Okay. The thing is, what I will say is most of the people, that is true, sir. Most of us actually want to stay in medicine, to be in
yeah,
medicine actually, but because of this trend going on, everyone is landing up in super specialty.
yeah.
So I had made a clear mind कि if I am not getting nephro this time,
Mm,
I will be
mm.
sticking to medicine because I love medicine. I will
Okay,
be sticking to medicine. Just if
okay,
possible, because I had a year कि my nephro and rheumatology, these two subjects are close to medicine, and I will be like
yeah,
in touch with medicine. So, I said, okay, fine, nephro is fine for me. Otherwise, like, if I will say that if you are really interested in medicine, stick to medicine. It's much easier, to have a good, if you are interested to teach or being a consultant in some institute, it's much easier being a medicine specialist nowadays, I feel. And,
yeah. Correct.
like, you see all kind of cases. You are like what you call
Boss.
like a cellular bombs. You keep on like you
Yeah,
diagnose something. Okay, you will be to a certain extent you can manage, but it will be like
yeah.
each case will be a challenge for you every day. So what I was saying is, if you really want to stay in medicine, you love medicine,
Mm,
you can always stay back
mm,
in medicine. Do your SRC from a very good institute. That matters in long run.
yeah,
Do your assess from a good institute, and you will have you'll have a wide options. There's a real scarcity of like a good general physician, and you can join in any
mm,
institute there. as a medicine specialist, you have a great scope for teaching and practicing. That's what I feel. Okay.
I also agree to what you're saying with a slight difference. That means medicine, of course, is the best. Everybody loves medicine more than specialty, no doubt. You can do SR from a top college and you can further brushing it up and you can become very strong. But then when you go back to your native place, everything will crumble down. Okay, as long as you are in Delhi, as long as you are in Chandigarh, as long as you are in a central institute, everything will work. You imagine that you do all these things, have all this medicine backup, and suddenly go to a tier 2 city or a tier 3 city, and then you understand that there are some very like average level hospitals or medical colleges there. Whatever you have studied, you cannot apply here, nothing. Here, the patients are being referred by the medicine person to specialist. That's the role of the medicine person. Then where do you stand? So if you want to stay back with medicine, you need to be very sure with two things. One, you will work in standard first tier institutes all your life, whether it be central institutes or private institutes like Amrita or like SRMC or like Manipal, higher level colleges, higher level institute. Second is that if you are planning to go back to your place and get out of these central or major institutes, you have a setup of yourself to practice. You should be having the money backup from your family to start a setup. If you can start a setup, then you are not under anyone. You can diagnose and you can keep on referring the patient for management. The essential core difference between medicine and specialties, medicine is about diagnosis, specialty is about management. So skill you require to manage is much less than the skill you require to diagnose. So if 10 people study nephrology, all the 10 will look more or less the same. But if 10 people study medicine, they will look at 10 different levels. One will be extraordinary, another will be average. But once you do specialty, because you're following guidelines and managing, everybody will do the same. So individual skill to showcase in a specialty is very difficult. Individual skill to showcase in medicine is very, very easy. That is why you ask like about 5 PGs passing on nephrology, you'll see all of them are competent. Yeah, you take the patient to anyone, it's okay. But 5 PGs in medicine, you show them, you tell you go and show that person itself. He is very good. Or the other one is average. So that is because diagnostic skill from person to person varies. So if you want to stay back in medicine, be very clear that you will work only in such places, or you will get terribly repressed. The moment you go to a normal center and start practicing medicine, you will understand there is no role for medicine there except that of a traffic police officer who will just kind of shuttle cases here and there. So that is why I'm telling you, if you have the guts to stay back, you should be in a central institute or in a top tier institute. And if you're going out of it, you must be starting a setup of yourself. So that is my take. And more than that, I'm again thinking of asking you this question. Like, what do you feel in the present scenario about your APs in medicine and your APs or PGs in specialty? What difference do you see in them?
Sorry, between difference between, sir, the APs
The
in medicine.
assistant professors that you are seeing and SRs that you are seeing in medicine versus the assistant professors and SRs that you are seeing in nephrocardio, neuro, like that.
Difference, I would say, obviously, when you are studying a particular subject, doing DM in that subject for 3 years, somewhere you will have that tunnel vision. You try to pull everything to that your specialty diagnosis. Only that would be the difference, and they will have much clarity in managing the case. Okay. Other than
my
that,
doubt is, do you feel that they are little on the backside with respect to overall knowledge when they study only one subject?
Yeah, that's where like overall knowledge, they nowadays, like I feel like there's some bit of diabetes or some other complication, like they are all the other year. They are not ready to take up that medicine challenge. Like, okay, I am also a medicine specialist. I can manage. I need to know all these basic things also. So that is where somewhere it's happening. But it does happen when you are like studying into that subject for continuously 3 years. No, you somehow you become tunnel vision to your subject. And I feel that, okay, if you're doing a specialty in this subject, you need to excel in your subject first. Okay, that should be a priority. Yeah.
Fine. So what about like difference between studying in a center like yours where there are super specialty PGs left, right, and center, versus in a center where there aren't much PGs? How much clinical exposure more than that hands-on did you get during your PG? What are the procedures that they help you to do?
Yeah, I will say that, okay, studying in a center institute or a very tertiary care institute, the pros part are you are always under, like you are posted in super specialty. You get to see all those cases that you read in your books, and you learn directly the actual correct management that should be done. You don't have to read your books, just see what your DMSR is doing. Okay, so that becomes a reflex that comes as you will learn that reflex to do what are the things to be done in this patient. Okay, so that is an advantage, I feel.
And second thing is you will get to do procedures like we used to do all kind of intubation, like lumbar puncture, chest tube, all central line, left in and left out. That is obviously when you are in a tertiary care institute, you get to do all these procedures, So that this helps you actually. This helps you when you come back to some other place. Now, you know how to do all things. You'll be confident about you will not be dependent on other people. For all these
Very good.
small things. Yeah, you can manage your operations well. What is the con part I felt is, since we are always under an umbrella, under a protection of a senior SR, so that the capability to take your own decision, own bold decision, and manage the case. That's where like we do lag somewhere in between, because you know that always there is someone there up above you. Even if you make mistake, it will be corrected. So the decision making part I feel is I have like we are not that up to mark. That you will get it when you are like in a other institutes where you are the only PG there, where you make your decisions and you make mistakes and you learn from it. So that is the only difference I could feel. But I feel that eventually in life slowly you will learn that skill somewhere. But getting exposure to more number of cases is more important.
More important. Yeah, that's perfect. And that is why I think having an umbrella in the initial part is very important, because otherwise you really don't know where you are heading to. Now coming to the next most important question. Take us through final year. How do you study medicine final year for theory? What is like in this such a vast subject after having worked for 1.5, 2 years, when you plan to study, leave aside DM everything, how to study and pass?
Sir, actually, in PGI, it's nothing first year, second year, third year. Okay, you are the
Yeah,
same throughout the 3 years.
yeah, I know.
Okay, so
Yeah,
even on the 2 days before your exam, you need to do your duty and manage the cases
yeah,
equally. And if you are doing some
yeah.
mistake, you will be like uh,
Fired, yeah, I know, I
you will
know.
be higher or lower. So, but that is there. But for final year, I would say there's no. If you have done your postings generously, you don't have to prepare too much for your final exam. Okay, just
Exactly.
during your posting, if you are at that posting, finish your clinical examination part. Be thorough with that. As a medicine person, you should be thorough with clinic. So when you are posted in neuro, when you are posted in cardio, so you should make sure that within first
Yeah,
7 days, I should finish up my clinical examination part and see,
correct.
like, you will get to see the cases. Just go by yourself, just see the cases,
Yeah,
see the findings. Whatever you are having
yeah,
doubt, ask your SRs. Don't be afraid, just
yeah,
ask SR
yeah,
consultant. Okay, at that moment they
yeah,
might get irritated when you ask questions, but at the end
yeah,
they will only come and say that, okay, you are the person who are listening actually when I am saying, that's why you are asking question. They will be happy with
yeah,
you. Okay, so
correct.
I feel like it's not like don't wait for the final year to prepare for your exam. When you are posted
Yeah,
somewhere, it's always to see your case live and learn directly from your books and see.
super.
Okay, that is where
Great.
I feel. And in my final year, I would say that okay, we had to prepare like the core subjects: cardio, neuro, pulmo, and gastro. Obviously, these four subjects are like major subjects we need to focus
Yeah,
for exam, our MD final exam. Okay, so I read like, I will say that I read my again the MD during the medicine notes. Okay, and I'm a person who, like, I don't read a particular book or particular year or anything. I just if I get an article from somewhere or up to date or Harrison, like I have multiple sources for multiple topics. Okay,
yeah,
so it's not like I keep on preparing from the same books. But I felt is
yeah,
what I when I read, like, we don't get time also to read Harrison in, like,
yeah, correct.
3 years of year. So when I read through the Harrison, I felt like, okay, I have seen this case. I have done, whatever the next step,
Exactly.
whatever the investigation, already I have done. It was like a very
Yeah,
easy brush up for me. Okay,
it's the
so
brush up.
I feel,
Yeah, correct.
yeah. If you want to stick to one book, I will always recommend Harrison. Harrison is like, you keep on reading every day the same topic, you learn more and more things from that same paragraph.
Correct.
Okay, so I feel read Harrison. Okay, especially the clinical examination and the first 300, 400 pages of Harrison. That is very important. You need to know each and every one of those first 200 to 400 pages. Okay, if you know
Yeah.
thorough with that, I'm sure you can, like, answer most of the questions asked everywhere.
And what do you think is the role of this SS app on the whole for a person who is in final year of his MD? What does it do to him? Where does it take him? And how do you rate these videos in toto, and especially in nephrology? with respect to a person who's in final year MD? Can it be sole source of preparation going into the exam, especially when you can't like sit and read the whole book, etc.? Where do you place that?
So what I will say is that if your time permits you, okay, I will say that why don't you start early? Why don't you learn things from the best person? Okay. So you go, suppose you are posted in cardiology, you are posted in nephrology, or you are posted in, if you I am sure you will not be able to see all the videos of that subject during your posting. But you know this there are these 10 most important topics which a medicine specialist should know at least. Just see those videos from the super specialty, learn from the super specialty, and if you retain even 50% out of it, 50% of the thing, you will be like way ahead than others. That's what I personally felt. So I would say
Yeah,
that during your posting, you can use these videos for that particular subject. Choose all the important topics, list out your 10 important topics, and just see the videos. Don't have to make notes itself. Just see those videos and listen
correct.
what they are saying. Because being a super specialist, they know what you should be knowing, the finer
Yeah,
details. Okay. So if you are able to retain 50% of it also, it is more than enough for your like preparation for the DM later on. Okay.
fine. And when you thought of like nephrology as your career now, the most important thing, and you wanted to make a plan for preparation, did you have a plan? What were your plans? What did you watch? How did you watch? How many times did you watch? Please take us through your proper. We come to the first proper question. Till now, we're asking random questions to just get
Yes.
your view on things. And come to the first proper question on your preparation in nephrology and how the app and everything, how it is helped and how in total you prepare.
I will say, sir, actually, I could finally decide my subject in final year itself. Ki, okay, this is
Okay.
nephrology, what I want. If I want nephrology, or I will stick to my medicine. That's it. There's no
Okay.
other
Yeah.
subject. Okay. So first
Yeah.
I decided nephrology, but I thought no, I need to make my like this 3 year is the only time where I will get to read my medicine. Okay.
Yeah.
So I thought, no, this 3 year I'm gonna like dedicate. I'll try to learn all subjects as much as possible and
Yeah.
see all cases
Yeah.
as much possible. This is the time. This opportunity
Yeah.
won't come. Okay,
Won't come again. Yes.
nephrology. Yeah. So then I thought I'll after finishing my exam, MD exam, after passing, and then I thought, okay, I will take a break. Okay,
Mm.
go back to my home, to my village. Okay, sit, enjoy like with my be there with my parents, have food at home, and prepare for my super specialization from Arrow itself. Okay, so obviously I had seen few videos of my MD exam also from nephrology, 2 3 videos, and then I was quite sure that from one I was sure that okay, I will be sticking to this only, this video. So
Mm.
after that, like I finished up the videos in like initially 1 month. After MD exam, you need break, you won't study much. So I was
Yeah.
relaxing a bit, seeing all my friends, and yeah, after 1 month, I just started watching all the videos. I made sure that I made notes. I watched all the modules every day, roughly 4 to 5 I'll make all the notes. I completed, I think, in 1 month.
Oh.
I completed everything in 1 month, and the all the videos. And then I thought I will stick. I'm not going to, for my preparation, I'm not going to see any other source. Okay, many of my seniors said like you have to read Fiali completely, and I was like, I have only 3 months with me. Reading Fiali completely will is practically not possible at this point of time, and if I read also, I won't be able to revise it. Okay, that is most important
Not
for
only
me.
that, I think whatever is there in Pigali up and above that is already there in the app. I think
There,
I have read Pigali cover to cover maybe I mean umpty number of times. So I know
yeah,
better than Pigali what Pigali has written. I mean
definitely,
just in that way.
yes.
Because Pigali may have forgotten what he has written. But like I am religiously following the book, so I know better than Pigali what he has written. So okay.
Yeah. So I feel you have to stick to one source. Okay. So,
Yeah.
I have been a fan of your teaching from first only. So I just noted down everything and stuck to that note. And then I kept on revising, at least like I revised that note 5 times. Okay. I have revised
Okay.
the same note. Say kept on reading the same things. Yeah. I didn't go anywhere else and like any other references. I just kept on reading these notes. Any questions I was not able to answer, or I that was not there in my note, just I will add on to that my notes
Yeah.
then and there. Then I have made up my mind that I won't be able to read Fiali, Okay, so how can I cover it is, if I am able to do a lot of questions, so
Yeah.
that's how I can cover the part which might not be there in the note. So I like tried my best to do as many questions as much possible from any source I get. Okay,
Okay.
so I did a lot of questions, and
Questions.
any question, like, yeah, and
Now,
at the I will,
Marrow has now just come up with a question bank. So I think
yeah,
before that, when you were preparing, we did not have the question bank. So
yeah,
you
yeah,
have actually tried as many sources possible. Correct. Yeah.
possible. Just for my just questions, nothing else. I needed
Yeah.
questions. That's it.
Fine.
Because when you solve the question only, you will apply your all your
Yeah.
concepts, and you will know your like shortcomings. Like, I need to focus on
Certainly.
this. Yeah, yeah. That's how. And
Did you
each
write the NEET exam in between?
no, sir. Actually, I clearly made up my mind. Either
Yeah.
I will do DM Nephro in a like Central Institute, or I will do my medicine SRSIP. I won't
Wow.
uh, take it. That's
Wonderful.
it.
That's great. Like you never wanted to come to a normal college, state colleges and do
No,
DM. You didn't want.
uh, and I think, like, if I knew that if I give NEET SS now, NEET SS has become a medicine pattern, completely
Yes.
medicine
Correct.
based.
Correct.
So I
Yeah.
was sure
Right.
that I will definitely not get a rank in top 10. Okay, I will get a rank in between somewhere, and at that
Yeah.
moment
Correct.
I will be stuck. Okay, whether to leave a
Yeah.
seat. At the same time, I
Uh,
didn't prepare that much yet for my central
yeah.
institute. So whether
Yes.
to
Yes.
take up that TA, so I'll be completely confused. It did happen during
Correct.
my PG time. So I didn't want
Yes.
to get back that experience. So I was completely
Uh,
clear what I want. Okay, I just
Very
wanted,
good.
okay, I'll prepare for my central institute. If I don't get, I'll do my medicine SRSIP. That's it.
Yeah. Very good. Super. And how much did you revise? What was your preparation strategy for the last 2 weeks before the exam?
Uh, Last 2 weeks, like as I said, revision is the key. Okay,
You were
revise
reading
your
your notes.
own. You revise your own notes. That's it. Keep on
Okay.
revising. Don't miss a single question from your note. Okay, that's
Okay.
in your hand. Questions can
Yeah.
come from n number of time, from n articles, from
Yeah.
n guidelines. But
Yes.
what is in
Correct.
your hand is your notes. Okay,
Your
and
notes.
in Marrow, like the notes, 80 to 90% of the questions you will be able to solve it. Obviously, for a central institute, those 10% of questions, that is to differentiate. You
Yeah.
that requires some kind of extra effort by each and every
Correct.
person. Okay, and
Correct.
that's also like how much you have done your medicine during your PG
Yeah.
time. That will also determine all these things.
Yeah.
So
Yeah.
I feel that, okay, rather than running for that 10% with multiple sources and confusing yourself, focus on those 80% questions which you can definitely answer if you like, if you are thorough with each and every line of your notes you have
Yeah.
done. So last 2 weeks, I made up my mind I should revise at least once in the last 2 weeks, and I should do a fast. Then whichever points I kept on forgetting, I used to just underline or
Yeah.
make a red mark it. And last 2 days, I need to fast revise those like underlined things. Just go to a reading. No need to like remember
Yeah.
anything. Just read it. That's it. And I used to make sure that at the end of each week, all the bookmarked wrong answers which I have done,
Yeah.
at the end of each week, I used to just see those, just read through those wrong answers, so that I don't commit the EA. So that was my strategy. Nothing like
Super.
some
Yeah,
book.
that's awesome strategy, man. I think it's like exactly the right way to go because if you are actually very clear of what you want, that is the basic thing. Your persona is what that matters. I guess you are a person who, like, right from the beginning, you know what you want and how to execute that. For such people, it's not a problem. Now, when you gave the exam, was the exam in line with what you thought, or was it a surprise, or was it easier, or same level, or tougher? When you got the paper at hand, what was your initial impression?
Um, First thing I will say, everyone, to all the PG students, don't think that the Central Institute exam are some out of the world exam. Okay, these are
Yes.
prepared
Yes.
by some normal persons. The
Hmm.
theory is same. Okay, the kidneys are same, the nephrons are same, everything is same. Okay,
Yes.
it's just that they just want to see how strong we are with your basics, in a basic
Yes.
concept. They don't want you to be like very hi-fi knowledgeable person who knows about transplant and all the latest immunotherapies, yeah, everything. Okay,
Hmm.
they want you to be a normal, a medicine person who has done his medicine posting, knows medicine, and knows the basics of nephrology very well. Questions were, I will say, on average side. Okay, every paper will have a distribution around 30 to 40%, the easier
Yeah.
side, 30% of average
Yeah.
question, 10, 20% of
Yeah.
out of there. So it was the same
Yeah. Yeah.
pattern I felt. It was not like I didn't see any question which was like out of the what I've never heard or never seen. Most of the questions
Correct.
you will be able, if you have read your notes, most of the questions you will be able to solve. Even if it's not their notes, you will be able to rule out few options. Okay, if you have read your
Yeah,
notes,
correct.
that's what.
Yeah,
And nephro is like very very closely related to medicine. So when you give a nephro
yes,
paper, it's very difficult for you to know that whether I'm giving a like which one is medicine question and which is nephro question. Okay,
nepotism, correct.
so that is a unless it's a
No,
hardcore nephro.
that's my question also. No, you roughly tell me how was the distribution? Glomerulus vascular
This
tubulointerstitial transplant dialysis. How many percent were we given? How was it distributed in your paper? What had maximum weightage?
So I will say that uh, like around 50% questions, like out of 80, 50 questions were like from medicine. Like, okay, but it could be
Okay,
like overlap with nephro. I don't know whether that
okay,
is a nephro question
yeah,
or
understood.
medicine question.
Yeah,
Okay, so roughly like 50% of the question, like 50 questions, it's such that if you are good with your medicine, even you will be
you
able
can
to
answer.
answer. You can
Yeah,
answer. Now comes the next 30 question. For that, obviously, you need to read your nephrology, core
yeah,
nephrology
yeah,
subject. Coming to the distribution of weightage pattern, electrolytes always important. You need to be
yeah,
thorough with electrolytes. Okay,
yeah,
and
yeah,
obviously it's expected from a medicine specialist to know about electrolytes.
yeah.
Okay,
Correct, correct.
so even in interview, you will be asked about electrolytes. So electrolytes, you should
Yes,
be very thorough.
yeah,
Glomerulus, you should be very thorough with glomerulus.
yeah,
Okay,
yeah,
and there's some amount of questions from transplant, but I transplant, glomerulus, electrolytes, basic nephrology investigations. Okay, these are the
yeah.
parts we need to focus more. And this
Mm.
dialysis and other parts, they don't give. You will hardly get 1 2 questions.
Yeah,
Okay, if you need to,
yeah,
but what is the, if you know about dialysis, from you need to know the basics of dialysis and the concept, and that will help you when you are like when you enter into DM also. So
yeah, correct, correct.
I felt you focus like more questions on from glomerulus and the transplant basics of nephrology and electrolytes.
Very good. That's what I have also always been stressing upon. Like you do your basics, do urine analysis, then come to glomerulus and do sodium, potassium, calcium, phosphorus. You are done. Mostly 90% of the questions you can cover that way.
Questions.
And
Yes, yes,
also,
sir.
like after giving the exam, what did you feel? Very confident that you will crack it, or like, what is your feeling coming out of the exam hall?
Truly speaking, sir, I was very disappointed with myself after the exam. Okay.
Mm.
Um, because first thing is, how I'll say everyone, like how did I appear for the exam? Okay, I had my simple strategy. At first, I need to mark all the questions which I was 100% sure. Okay, that
Okay.
it will be like correct. Obviously, you can't be 100% sure. Okay,
Yeah.
but okay,
Understood.
somewhere
Yeah.
I know that okay, this has to be the only option. Okay, so
Yeah.
that's I went like I did a first fast I went fast and just finished all those questions. And at last, I calculated I did 55 correct answers. So I thought,
Mm.
okay, 55 and maybe 5 are wrong. So 50 would be correct. I was sure that
Mm.
is 50 questions, so I would be correct. But the problem is like leaving 25 question is also not a yeah.
Not possible. Yeah.
You cannot get into top 10 by leaving 25 question.
Yeah.
So what my
Yeah.
senior had said is, if you want to come in top two, either you give everything or you don't give anything. Okay,
Correct.
that's
Correct.
where yeah. So I thought like on an average, I felt like attempt 75 questions at least.
Mm.
Okay, so I
Mm.
took the risk of those 20 questions. Like you will always in
Mm.
Central Institute, you will be
Yeah.
confused between two options.
Correct.
So
Correct.
I took the risk of those 20 questions and tried to, somehow like subconscious mind, if you have read somewhere, it will
Mm.
come. Somehow you will say,
Yeah.
okay,
Correct.
this is the answer.
Mm.
Okay, so I
Yeah.
just marked those questions and then I came out and I checked that like how many questions I could recall, 7 8 questions I checked, and all out of that 10 questions, two were correct and rest 8 were wrong. Okay, so I thought, okay, so
Mm.
I chose the wrong options. So,
Mm.
so then I thought, okay, this time up to इस बार नहीं मिलेगा. I asked my brother, get a Fiali. I need to read Fiali,
Mm.
I think.
Mm.
Okay, and
And
I
finally,
was
what
like,
was your score? Theory score?
theory score was 61, sir.
61. Okay. So
Uh,
that means like others haven't scored as much as you. Even if you
uh,
get it wrong, others have also got many more questions maybe wrong.
So that's what
Yeah.
my senior. Then I was like bit disappointed by, but my seniors, they said that it's not like the same thing happens with each and everyone. Okay, how
Correct.
much you have made mistake, they will also make mistakes. Okay, same thing happens, they will also choose the wrong option. So don't worry about it, you just wait for the result. So when the result came, I was like, I qualified for the interview. Okay, but
Interview.
still
Yeah.
I was like, I don't think I will make it to, like, my theory marks will be in top five. Okay, because
Yeah.
I knew that I had made many negatives. So
Yeah.
that, but anyway, we need to give your best. What is there in my hand
Yeah.
is now I got the interview where I can impress. Okay. So, I prepared for the interview bit, the practical things. I asked my seniors, what they asked during the interviews. And
So
fairly,
that's
they
the
said that,
other question that I wanted to ask you. Like when we were giving the exam until a long point in time before COVID, we were having separate exams, no AIMS, PJ. And AIMS used to have a different interview, PJ used to have a different interview. We knew the structure of the interview. It was like this much OSCE, this much question, this much case presentation, everything. But COVID completely spoiled all that. And from then on, we never have any proper interview. So now I am per se, if you're asking me, there's nothing that somebody can teach for the interview. Interview has basically become like a personality test. You just want to know the personality of the person, ask him two, three questions on thesis, and there is no preparatory guideline. So now that you have gone to the interview and got rank one, do you really stress on some preparation for interview? Just happily go say hi and come back and know about your thesis. Is that enough?
no, I just, I asked my seniors, that's
Yeah,
who has given the interview, who can best say like what
yeah,
usually happens there.
yeah.
So from there, I could collect the information that there will be a question on glomerulus, there will be an electrolyte, there will be a
Yeah.
spotter. Okay, that's how it's been
Okay, that's all.
happening for last 2 3 sessions. So
2 3 years. Yeah,
I hope that the same will continue. And I know in Central Institute, none of the like faculty usually they don't have enough time to prepare for new questions, and
yeah.
yeah, it will be like the
Correct,
same questions they will be coming
correct,
back.
correct,
Okay,
correct.
so so I thought, okay, I'll fix up this. I'll read my glomerulus. I'll go and read the KDIGO guideline on glomerulus again, just the
Yeah,
recommendations. Okay,
yeah.
so that's why I can impress them. I can say that this is as per the KDIGO recommendation.
As per KDO. Yeah,
And I prepared like the glomerulus disorder a bit again. I revised. I made sure, and seniors had said like about electrolytes and EA. So I made sure
mm.
that sodium and potassium and calcium, I know each and everything that could be
Every.
asked in this thing.
Yeah.
Okay, and especially the ECG part and all. We should
Mm.
know at what we should know the about able to interpret the ECGs and all, and
Yeah,
all the possible like images in nephrology what can come. Okay, I prepared for that.
yeah.
And I try to read the recent trials that could have, like,
Mm.
if I get a chance to use those names of the trial, I
Mm.
wanted to pull them to us, those things. So I was
Mm.
asked like about membranous nephropathy, and it was just to manage
Mentor.
proteinuria,
Yeah,
nothing else. Yeah.
yeah,
So I just said we will use ACE inhibitor and ARB. Okay.
yeah.
And he said, what other thing can you use, you think? Then I said, now recently the SGLT2
And
inhibitors have come up in the market, okay, based on these two trials. So, when you say this trial's name, and yeah, they get impressed with it, this guy is
yeah,
actually read, he knows the things, what is
yeah.
happening
True.
in nephrology.
Correct,
So,
correct.
and if you're seeing an ECG, don't jump into a diagnosis, just say whatever you know. First,
Yeah,
rate, rhythm, axis, CA, and then come to your diagnosis protocol. So
yeah,
these are the small things, if you can like focus. And even I got on CT, and I couldn't find what is the examiner asked, please say me the findings and your diagnosis. I didn't find any finding.
mm,
So I just said
mm,
all the normal things. This is a axial
mm,
CT, contrast, enhanced, cut,
mm,
and everything is normal here, there, normal, everything. Grossly, this CT looks normal to me. Okay.
mm.
And I was like waiting whether they will say anything or again, and then they went on to next question. So I really don't know whether I answered it correctly.
Yeah,
Did I
correct.
get it?
Yeah,
But at least I would be getting marks for correctly describing a CT. Okay.
yes.
So those
This
things
is more or
really,
less like the MRCP pattern that you're saying. In an MRCP pattern exam also, even if we get the final diagnosis wrong, if you've done all your steps correctly, you will end up getting very good marks. So
yeah,
exactly the same thing you're saying. Final diagnosis really doesn't matter. What you
yeah.
actually put up is what that matters. So that's perfectly said. So do you feel that there is any kind of a coaching necessary for your interview, or interview is something which each individual has to take by himself?
Uh, I feel actually we are like, the problem is we'll be very anxious. We have never given interview. We'll be very anxious about like how will it be conducted? What are the questions being asked?
Yeah.
So if we can get a platform where the things that are commonly asked, okay,
Yeah,
some mock interview sessions, if you try to answer in that way, no, that anxiety level little comes, I feel it
can
comes
come
down.
down.
That helps you better in your
Yeah,
performance. So I feel like, and you being an nephrologist, like you know better what practical questions should can be asked. Okay,
yeah, true. Yeah.
so that I feel
So
that,
I think
okay, some
actually
kind of
we'll include
yeah.
Ranjan also next time in conducting an interview mock for the next set of toppers, because you are just now fresh from the interview. That's like awesome, and I think we've actually general interview sessions we do with toppers are like 20 minutes, 25 minutes, max to max 30 minutes. Now you can see that we have crossed 50 minutes, because I myself didn't realize that we have crossed 50 minutes, because talking to you was not like talking to a topper. Talking to you like was talking to a normal junior of ours who has now done all these things and he's just sharing. So I think this interview will be of immense help to everyone. My last question for you is like your advice to two set of people. One set of people who have come to MD medicine but not got the college of their choice and hence feeling very upset that I'm not studying in a really good college. What will I do? How will I take my career forward? How will I go for DM like that? Second set of people who are thinking like at the end of DM, if I don't work now, then I don't have any money with me. Then how will I take my life forward? So for you, a person who succeeded, how can you actually give advice to both these set of people? I think that will be taken very seriously by the students.
First, I would like to answer the first question. Okay, first is
Mm.
you have entered to an institute. You know this is it. Okay, there is no
Yeah,
other, like you cannot change a institute. So this is what like God has given for you, and you need to accept it. That
yeah,
okay, this
yeah,
is the place from where I need to build up. Okay, this is not.
yeah,
I am lucky. I am lucky enough to at least get into the institute. There are thousands of students still reading and trying to get to this institute. Okay, so I
correct,
am much
correct.
luckier than those thousand students. Okay, so I am gifted in that way. Now I need to make use the best use out of it. Okay, so if I feel that if you really want to excel, okay, every institute has enough number of cases for an MD student. Okay,
Mm.
so you just need to even if I feel one case is good enough to teach you for a 1 week. Okay, if you see that case every day properly. Okay,
Mm.
so that is what first thing. Don't think that my institute is bad, then I will not be able to learn. It's on you how much you want to see. Okay, you go to your seniors, you go to your faculties. Everyone will love to teach you if you are really sincere, if you really want to do certain things. Second thing is, if you're thinking that okay, I'm not being taught well, there are certain places where there is an issue. Okay, you are not being
Yeah,
you always
definitely.
help so you can like you always have the help of Marrow. You learn from the super specialty the best faculty. As I said, during your posting, you just see few of those videos only and learn from the best persons. So in
Yeah,
that way you will be prepared for your future, so that you can answer easily later on. So that's what I feel ki, okay, if you are having some limitations of being not being taught properly, or you have always the Marrow videos to look up to those particular topics. Learn from the super specialist directly, make your notes and try to remember. There are ample number of videos in YouTube and these days. Okay, you can learn like good amount of like latest things from here. So it's on you. It's not like okay, any institute is bad or good. It's on you who make it bad or who make it good. Okay, if you really want to go up, you need to accept that I am this place and these are my options and I need to focus on them rather than focusing that I don't have this. Okay.
correct. And what about the second question about like having to stay independent after MD? How can we continue studying like this at this age? And those speculations, those kind of fears that students have.
Uh, See, to achieve certain great things, na, you need to, compromise a bit. Okay, you need to go through that hardship. Okay, so you need to take that bold decision. Ki, okay, I am gonna sit for this 4 months. Not an issue. My friends may be earning a lakhs of money. Okay, these four
Mm.
months, I'll give my best even in this 4 months. That's what I had a clarity in my mind. I will give my best during these 4 months. Even if I get, that's fine. Even if I don't get, I'll be happy. Okay, I have given my best. That's it. That's the one I deserve. This is the mark I deserve. I'll be satisfied with this preparation. So I feel that just sit once and prepare for 4 months. After that, if you're not getting, and yeah, you join some anywhere, join your senior residency somewhere, and you are already done with your preparation. Now it is like keep on revising the same things and
Yeah.
being in touch with the patients. But I will say that you need to little bit you have to compromise. You need to go through the hardship of that 4 5 months period. Okay, I know it is difficult at this age
Yeah,
to
correct.
sit. Everyone has expectation, a doctor hai, You will be earning a
Correct.
lot of money and
Yeah.
okay, people are there to judge day in and day out to us, but it's no, if we are clear where we want to go ahead, if we want to, if we want next 30 years to be good for us, we have to compromise this 4 months. Okay.
Very good.
And
Super. And lastly, from Marrow side, like you know how the super specialty office now, you have the video, the medicine part, the question bank, test series. Any suggestion that you have to make the app better for a medicine student as well as for somebody preparing for DM? Final year MD, we are actually catering to the PGs doing MD and of course preparing for DM. Any suggestion that you have to make it better, or what is your take on this? Because it's a new kit on the block. We just launched it last year, so all suggestions are welcome.
uh, these suggestions to the Marrow team, sir.
Yeah, sir.
Or
Total team. Yeah.
I will say, we need more number of, like, there was no question bank. That was a big,
Yeah. Now
big issue.
that's done. Yeah.
So we need lot. The only thing, because we can't read everything. Only questions are
Yeah.
the way
Correct.
where we can revise our
Yeah.
things. So
Yeah.
questions have to be there, and we need little more frequent, like particular that subjects tests. Okay,
Yes.
we
Yeah.
used to
Yeah.
have only hardly, like, in a 1 or 2 months, like we'll get one nephro test or EA. So we need
Yeah.
more number of tests. The more number of tests we give, more confident we become about future.
Yeah.
Okay, so I will
Correct.
I will suggest that we need more number of tests and more number of questions. And
Yeah.
second thing I will recommend is some kind of mock interview,
Yeah.
so
Sure.
that we are little well prepared for the interview. At least, like,
Yeah.
that anxiety level should go there. What happens there? Someone needs to say us.
Correct.
Okay,
Yeah.
so that will really actually help us in
Yeah.
preparing for the interview part, because interview is like, where you are cleared, but you are still not selected because there's an interview.
Yeah.
Okay, so that is
Correct.
a very
Correct.
tough situation to be in. Okay,
Yeah.
and if you can include more, few more practical questions and image based questions, because I know slowly things will evolve. Slowly,
Yeah. Fine.
specialty also, they will start asking image based, more of practical
Yeah.
based questions. That
Yeah.
will
True.
also really help, I guess,
Yeah.
sir.
Fine. Okay, man. So on the whole, wonderful discussing with you. All the best for a very, very prosperous career. I don't think I have to wish you. You will have, because I think if somebody has watched this interview from head to foot, he will know that your attitude. I think many times I feel like this is the way it has to be. But like when as a student you come it out and telling the open, I think it relates to a lot of people. For any young person watching, for any undergrad student watching, I think if you have this kind of an attitude and outlook towards medicine, everything else will be easily taken care of. Whether you are born and brought up in UK or you're born and brought up in Orissa, it doesn't matter. Absolutely, it doesn't matter. It is
Yes.
in our hands essentially. There are few things which are out of our hands, but like majority things are in our hands. So
Yeah,
wonderful
there's
discussing with you. Thanks a
no,
lot,
no
and I
doubt.
know that you're taking time out of a lot of other important things in your personal life. So thank you, thanks a lot, and wishing you all the very best.
Thank you, sir. Thank you. I will really like to thank you, sir. It's because of your, hard effort you put in to make those videos. I could, like, get through this. Because I didn't refer to many standard textbooks or EA. I just went through your notes. So I really thank you for that, sir. And obviously, I'll thank my parents, my friend, my girlfriend, my juniors. Without them, their support, it will be a difficult path.
Okay, thank you.